self-test. Before we move on to the individual lessons, let's find out what your current state actually is. With 3 simple exercises, you may be able to locate where you have strong muscle tension. You can do this self-test again and again to measure your progress as well. You don't have to prepare yourself for this, just take a yoga mat and wear comfortable pants. Lie down comfortably on your mat. Place your arms relaxed next to your body and straighten your legs. Now, bend your legs slightly so that the hollows of your knees form about a 90-degree angle and the legs don't touch. We now want to see whether you have any tension in your lower abdomen and pubic bone area. First, take a few deep breaths. Inhale deeply through your nose and take a long, full exhalation through your mouth. Again, breathe in deeply through your nose and then out through your mouth. Now take a deep breath through your nose and try to draw all the air into your stomach and down into your pelvis. Really inflate your stomach while doing this. Keep breathing in, take in as much air as you can. Do not tense your stomach, but give it as much space as possible. Continue to draw air into your lungs until they are full and then hold your breath. Your lungs and your stomach are now full of air and now you are trying to force this air into your pelvis. Concentrate. You don't have to tense your pelvis or stomach for this. Just try to squeeze the air out of your stomach deeply and into your pelvis. What do you feel now? Do you feel an uncomfortable feeling of pressure in the lower abdomen and over your genital area? Or are your symptoms just getting worse? Or do you suddenly have a strong urge to urinate? Then breathe out slowly for now. Take a few more breaths to relax again. If something was uncomfortable or you felt a strong urge to urinate or increased pain, this can be a clear sign of tissue tension in the lower abdomen and pubic bone area. Completely healthy people do not feel anything doing this exercise. If, however, tension is present, then inflating the pelvis with air leads to the tense areas becoming irritated. All right, let's move on to the next exercise. Lie back on your back in the same position. Relax your arms next to your body, stretch your legs first and then set them up at a 90-degree angle. This time, however, the legs are a little further apart so that the feet are a little wider than your hips, roughly on the edge of the mat. With this exercise, we want to find out whether you have tension in your groin or your thighs. To do this, we test one side at a time. First, let your left leg tilt slightly inwards. Make sure that your feet do not move and that they are firmly on the floor. It is also important that you do not turn your upper body. Leave both buttocks on the floor, only the left leg is tilted inward as far as possible. Make sure that both of your shoulder blades continue to touch the mat as well. Tilt the left knee inwards until it goes no further. Now we bring in the right leg and you start to tilt the right leg to the right and outside. Do this very slowly and concentrate on keeping your shoulder blades and buttocks firmly on the ground. Now slowly go to your limit. Both the left and the right leg are now both turned to the right as far as possible. Check again how it feels as you continue to breathe in the relaxed position. Do you feel a pull on your inner thigh, your buttocks? If so, on which leg and on which side? Because here too the same applies. If all the muscles and tissue are fine, you won't feel anything. But if you do feel something, then make a note of this point and the point that either hurts or the point that triggers a kind of blockage. Then go back to the starting position and repeat this for the other side. Relax in the starting position, feet roughly on the edge of the mat, buttocks and shoulder blades are firmly on the mat, and now you slowly turn your right leg inwards until it goes no further. This is followed by the left leg, which now falls to the left. Keep breathing and let your legs fall outwards as far as possible until you can't go any further, even with pressure. And then stay in this position for a moment and see how it feels. Do you feel tension in some places, or are you very flexible and both legs fall far apart until your kneecaps almost touch the sleeping mat? Compare both sides. Could you let one leg fall further in one direction than the other? Quite often tension is only one-sided. So please repeat these exercises again and make the direct comparison. Is there a side or direction where one leg is more likely to be immobile? If so, well, that can clearly indicate tension. Finally, we do a little variation of this exercise. Lay on your back, arms at your side, legs outstretched, both feet on the mat. Now let one foot fall slightly outwards and try to touch the ground with your toes, with your legs outstretched. Don't worry, you don't necessarily have to touch the ground, but how far can you turn your foot outward? Now switch sides. How far can you turn the other foot outward? Is that going as far or less? Now put both feet in the middle of the mat next to each other with the tips of your toes up. Relax your legs completely and let both feet fall outwards naturally. Do both feet fall equally far outwards and form a kind of V shape? Or does one foot fall outwards at a greater angle than the other? If both feet are not evenly positioned, it can be a good sign that you have tension in one of your thighs or buttocks. If, for example, the left foot does not fall so far outwards, this can indicate tension or shortened muscles in the left thigh and inner thigh, as well as tension in the right buttock. Alright, that was a little test of the limits of your flexibility. Many sufferers with chronic tension feel a slight flare-up of symptoms during these exercises or notice that there is a certain amount of immobility. Sometimes it feels like there is a blockage even if pain is absent. But even if you were able to do everything comfortably and you are incredibly flexible, you can still have tension in completely different places. These exercises should only be a beginning to explore step by step where the causes of your symptoms are. Maybe these self-tests were already helpful for you, maybe you still have something more searching to do. Either way, let's go straight to the next step and get into the exercises.